this video, we're going to look at the biomedical waste disposal. Waste disposal. So, to begin with some questions, the first question is the human anatomical waste and along with the animal anatomical waste. So, which bag is used for this? And another thing would be the next question is how is it disposed? This will be a question one. How is it disposed? The second question we want to ask is in terms of discarded, the discarded linen, then also the mattresses, the beddings, which have blood clots, and also in case of the routine masks as well as gowns. So all this, where is it? What color of bin is used and where is it? How is it disposed? The last question is what is the red bag? So what are included in what are disposed in the red bag? So what are the type of waste in the red bag along with the disposal methods? So in this video, you will find the answers to all these questions and learn a lot more. To get started, first we are looking at the yellow bag. So the yellow bag is nothing but it is non-chlorinated, NC. And first we are looking at the human anatomical waste as well as the animal anatomical waste. So here the disposal will be by incineration. There is incineration as well as the plasma pyrolysis and the deep burial. Then we look at some solid waste. So what does the solid waste include? So it can include items such as the dressing materials, the cotton swabs, the plaster swabs, the plaster cast, and they can also include the contamination along with blood or body fluids. They can also use the bags containing the discarded blood along with the bags containing the discarded blood. So all this is disposed by incineration as well as the plasma pyrolysis or the deep burial, or it can be done by autoclaving. Next the microwaving or the hydroclaving. So later it is also done by, you also have some methods such as shredding and mutilation. So you can do the shredding as well as the mutilation. Then as we move ahead, we have some discarded linens. So discarded linens and also the bedding materials along with the blood stains, then also the routine masks as well as the gowns. So all this, the non-chlorinated chemical disinfection, this non-chlorinated chemical disinfection, and this is followed by, there is also the incineration as well as the plasma pyrolysis or for energy recovery. In absence of this, we can also use shredding. Or we can use the mutilation as well. Mutilation or a combined sterilization and shredding is used. Okay. So you can also use the sterilization along with the shredding. Now we move ahead. We look at the microbiology. The microbiology as well as the biotech. The microbiology, biotech, and the clinical lab waste. So what does all of this include? So here there is blood bags. There is blood bags as well. There's lab cultures. There are stocks and specimens of microorganisms. That is the specimens. There's live and attenuated vaccines. There is human and cell cultures, viral cell culture, animal cell cultures. So all this is used. So all these items which are used in case of the research, also in case of the industrial labs, and in production of the biological residual toxins, dishes and devices, and also the devices which are used in cultures. So all this, how is it disposed? There is a pre-treatment with the non-chlorinated chemicals. There's non-chlorinated chemicals which is used. Later, there is the incineration which can be given. Then we look at some expired discarded medicines. The expired medicines. Expired medicines are the cytotoxic drugs. So expired medicine and the cytotoxic drugs, how are they disposed? So here we need to know it can be disposed by incineration or the plasma pyrolysis, or it can also be in case of the secured landfill, can be disposed in the secured landfill. Next, we look at the chemical waste. So how are these chemical waste disposed? So in terms of the chemical waste, it includes the chemicals used in case of the biological production and used for the discarded disinfectants. So how is it disposed? Disposal is by the incineration and the plasma pyrolysis. And there is encapsulation, that is a hazardous waste treatment, storage and disposal facility. Now we look at the chemical liquid waste. So in terms of the chemical liquid waste, they are the liquid waste generated due to the use of chemical production of biological and used or discarded disinfectants. So they can also use the silver X-ray film developing liquid, the silver X-ray film developing liquid. So this developing liquid, then also the discarded formalin, the discarded formalin, and also the infected secretions, the infected secretions, and the aspirated body fluids, and also the liquids from the labs, liquids from the labs, and the floor washing, cleaning, the housekeeping and disinfecting activities. So what is used in the housekeeping as well? So all this, how is it disposed? So how are all these disposed? So it is by, so there is after resource recovery, the chemical liquid waste, chemical liquid waste, chemical liquid waste, it is pre-treated. It is pre-treated after, before mixing with the other wastewater. So it is pre-treated before mixing with the other wastewater. Then we move on to our red bag. So what is this red bag? Red bag is nothing but it is non-chlorinated. So here the type of waste, it includes the recyclable contaminated waste. So recyclable contaminated waste. So what does this include? So it can include the contaminated waste tubing. can include the tubing, it can include the bottles, it can include the intravenous tubes or sets, catheters, urine bags, as well as a vacutaneous with needle cuts and gloves, vacutaneous. So all these items are included in the red bin. And how is it disposed? So disposal is by the autoclaving. So it is disposed by autoclaving. There is also the microwaving, autoclaving, microwaving, and the hydroclaving. So all this is followed by, there can be the shredding or the mutilation. There is the shredding or the mutilation. And later the energy recovery, the plastics to diesel or fuel oil road making. And other thing to notice, it is not sent to landfill. So the red bag materials are not sent to landfill. Whereas we saw the yellow bag, most of the items were sent to the landfill as well. Then we move on to the white bag. So what happens in the white bag? So white bag is nothing but it is translucent. It is puncture. It is puncture proof as well as it is leak proof. So this, it includes waste sharp including metals. It includes sharps, it includes metals as well. So there are needles, syringes, fixed with fixed needles, the needles from needle tip cutter, burner, and there are also, it includes the scalpels, it includes the blades. There are some contaminated sharps, the objects which may cause the puncture or the cuts. So which causes the puncture or cuts, and they include both used and discarded contaminated metal sharps. They used as well as the discarded and contaminated metal sharps. So all these items, if you see, they are, how are they treated? So the treatment is by, so it is by the autoclaving. So you can do autoclaving. There is also the dry heat. There is a dry heat sterilization. So all this is followed by, you do the shredding. So they do shredding and the mutilation as well as the encapsulation. So this is done. Then later on, the iron foundries and the sanitary landfills and waste sharps. This is also done. Then we move on to the blue. So blue is basically, it is puncture proof. It is puncture proof. It is puncture proof and also leak proof. And as the name suggests, it is a blue marking. So it includes glassware. It includes the glassware. So it includes the broken and discarded and contaminated glass, including the medical vials and ampules. It contains the ampules as well, except those containing the cytotoxic waste. So it does not include, not the cytotoxic. So not the cytotoxic waste. Then also it includes the metallic body implants. So metallic body implants. Okay. So this is also a type of waste. So all this, how is it? How is it treated and disposed? So here the disposal is by the sodium. There is sodium hypochlorite. The disposal is by sodium hypochlorite. Then there is the autoclaving as well as the microwaving as well as the hydroclaving. So all the clavings come here, hydroclaving. Later it can also be used for the recycling. It is recycling. Now we jump on to, so that was about the biomedical waste management. Now we'll be answering our questions. The first question we asked was the human anatomical waste and the animal anatomical waste. So how are they disposed? So the disposal is by incineration as well as a plasma pyrolysis, also by deep burial. This was our first question. The second question we asked was, in cases of the discarded linen, the bedding, contamination with blood, also the routine masks and gloves. So how are they disposed? And what bag is used? So in case of the first case, the human anatomical waste and the animal anatomical waste. So how are they disposed? So the disposal takes place in the yellow bin. And the second question, the discarded linen and the routine gown. So this is also disposal is in the yellow bin. And what are the other details we need to know? So the discarding is by a non-chlorinated. It is non-chlorinated chemical disinfection. So it is followed by the incineration, plasma pyrolysis, or for the energy recovery. So in absence of the above facilities, there can also be shredding. Shredding can be done. So there is shredding. So shredding can be done. Also, there can be mutilation. There is mutilation or the combined use of sterilization plus there is also the shredding which can be used. Next we move on to the next question we asked was, what are the red bag? What is the red bag associated with? So if you see the red bag, it includes a recyclable contaminated waste. And other thing to note is that the red bag, it is non-chlorinated. So the contaminated waste tubing, so it contains the contaminated waste tubing. It includes the bottles, the catheters, urine bags, and it also includes the vacuotainers. There is vacuotainers with the needles cut, and there is also the gloves. So all these items, how are they disposed? So there is autoclaving. You can do autoclaving. There can also be microwaving, autoclaving, and hydroclaving. So all these clavings can be done, and it is followed by, you can do the shredding and the mutilation as well. So what can you do? You can do the shredding. There is shredding as well as the mutilation can be done as well. Shredding and the mutilation. And later on, you can do the energy recovery as well as the plastics. You can do the plastic to diesel or fuel, oil and road making. And other thing to note is that there is no use of landfill. So the landfill technique is not used. So now we'll move on to some bonus questions. You can answer these questions in the comments. So the first question we want to ask is, what is the role of the blue bin? So this blue bin, so what are the type of waste? So what are the waste materials which are present in this blue bin? And the next question we want to ask is, what are the materials, the method of disposal of this? The next question here we want to ask is, what are the white bin? What is the role of the white bin? So what are the waste and the disposal of the white bin? So you can answer these questions in the comments.